The best medicine for them is to see their remaining parents' courageous attitude. Mirroring them, they'll be more likely to say, "This is difficult, but we'll get through it. We'll be fine."
Yeah, there's a number of really practical things that parents can help a child with. The first is to really check out the child's understanding of death. And that can certainly not wait until there has been a major loss for a child. There can be death lessons in effect. So when pets died, when more distant friends, adult friends of a parent or distant relatives, to check out the child's understanding of death. Remembering that young children can be very literal in death, so not to use confusing, not to use vague terms, but to talk about how the body has stopped functioning, stopped breathing, things like that. In a somewhat older child, to be very sensitive to their feelings, such as their own fears of their own death or the death of other family members. So to be aware of their understanding of death, to be aware of their thoughts and their feelings about death and losses, to be really, really patient and understand this is a process, it's not an event that happens, that the child is reconciled to a death. And to understand that you can model emotional expression, can model compassion for a child. So providing a secure, compassionate environment with people who are emotionally open is just so important.
Children will need to work through grief from their own perspective. They might fear being abandoned by the remaining parent. They might worry that somehow they are to blame. They'll often direct their anger and confusion towards their own siblings. They can resolve their grief experiences by staying closely connected to their parent. Of course, this is challenging because you're struggling with your own grief. If you're struggling to give your child or children the emotional support they need, you should ask a professional for help.
If a parent is really struggling with loss and their own bereavement and grieving, it would seem that a child is going to have a much more difficult time with that. If there's not an emotionally safe environment in that family, cause enormous difficulties for the child in getting through and getting on with their lives. Even very young children can see themselves as a parent in the family, not only to other siblings, but in particular to the surviving parent. And one of the more disturbing things I've seen is after a loss and trauma, a young child feeling an obligation, a need, all the guilt that goes along with having to feel they are responsible for the emotional well-being of the surviving parent. Any major event is going to affect behavior, it's going to affect emotions, it may even affect physical health in a child. Children will worry about their health, particularly kids in the early school age, perhaps 6 to 9, 6 to 10. Very often will start to think about their own health if a parent or a sibling or close relationship of any sort has been ill prior to a death.
It was bedtime 3 months after the children's mom died. Jesse, the now surrogate parent, ran in to tell me that his younger brother Jonathan had just told him he was going to run away from home. I went into Jonathan's bedroom and sat on the bed with him, and I asked him, "Is this true, that you're going to run away from home?" Jonathan looked me right in the eyes and said, "Yep." I was quiet while my mind raced, wondering what to say to this sensitive 6-year-old, all the while really trying to camouflage my aching heart. And then I said, "Can I come too?" Not missing a beat, Jonathan said, "Yep, and Jesse and Sarah and Rebecca too." So we spent the next hour planning our getaway.
A death, certainly one of the biggest and most traumatic events in a child's life. Probably the biggest traumatic thing a young child could experience.
Most children are fully capable of resolving their grief as fully as adults are, especially in a surrounding that is supportive and understanding. Here are some of the warning signs that your child might need professional help. They may experience a long period of depression with loss of interest in daily activities. There might be an inability to sleep or a loss of appetite or a prolonged fear of being alone. If they act like they're much younger, that might be a warning sign. Denying that the family member has died or imitating the dead person all the time is also a warning sign. Talking repeatedly about wanting to join the dead person or withdrawing from friends is also a warning sign. Certainly, a sharp drop in school performance or refusal to attend school can also be a problem.
Most children are going to have a period of denial if they've lost a parent or a sibling. That denial may cross the line with more and more retreating into a fantasy world. Some of that will be quite normal, but if that becomes a preoccupation or starts to interfere with a child's life for weeks or months on end, that's not a good grieving. If a child is angry, when that anger can become disruptive again for weeks or months on an end, or extend out for 1 or 2 years after the loss, that's not so good. With sadness, if sadness slips into a true depression, particularly again after 6, 12 months after a loss, if worry becomes preoccupying to the child, trouble sleeping, just almost in a panic that something will happen to the surviving parent or surviving family member if they're out of their sight. Those are signs that this is not a usual process of grieving.
I think for children, and I do like the phrase, the forgotten mourners. I think children are often the forgotten mourners. Sometimes people say, well, children are young, they're resilient, they'll just go through this without a bump. Or they say, oh, they don't really understand. Well, we've learned through years of working with children really do understand. I believe if children are given permission to mourn, they actually know how to if we get out of the way and we create ways that are familiar to children to help them to find ways in their personality to mourn.
Children are both vulnerable and resilient. Their need for stability and predictability is a given. However, they can adapt to even sudden changes if there are support systems in place. While watching for warning signs, be attentive yet positive about how the family and they personally will fare. They will tend to follow your lead. If you are struggling, be sure to get help for yourself, as the children need you to be there for them. Most children can travel through these days of loss successfully.